Hello, good afternoon, good morning, good evening, whatever time you may be watching this. My name is Woody Collins and I'm with Congo Helping Hands. And each day I do these talking about Congo episodes. And today we have an episode on why so many people die of preventable diseases. Why so many people die of preventable diseases. And if you're getting some value out of this, or if you like it to subscribe, like it, and also let your friends know about it. Share it with your friends. We would appreciate that. So let's go ahead and get started on that topic. What is preventable diseases? You would probably want to ask. And I'm gonna rattle off a few preventable diseases. Ebola, HIV/AIDS, cholera, typhoid, polio, measles, tuberculosis. Those are just a few of the preventable diseases. And those will actually kill you. I mean, we may have heard about Ebola killing people, but we also may know about AIDS killing people. But here in the United States, we don't hear too much about cholera killing people, typhoid killing people, polio killing people, measles killing people, and tuberculosis. The reason why is because the health systems in our country have available not only vaccines, preventatives for that, and they make them widely available, but they also have treatment. We have abundance of treatment that can keep us. We may get sick from it, but we may not die from it. A couple of years ago, measles at an outbreak in schools. I don't think anyone died from that, but it was a measles outbreak because they were treated. In undeveloped countries, poor countries, you have a problem of they are what Dr. Eugene Richardson, he's the one that they interviewed, NPR interviewed for this article that I was referenced in the uh, notice for this telecast. He talks about the global south and the underdeveloped world. Dr. Richardson is a physician and anthropologist. He's worked with Doctors Without Borders in Congo, Sierra Leone, South Africa, Peru, all places that we refer to as the global south, the, the southern hemispheres around the world below the equator. That's the problem, and that should give you a hint, is the countries in the northern hemisphere, they colonize the countries in the southern hemisphere. That's what they did. So people from Europe, mainly, they colonized Africa, South America, places like that. So that's why you see those, and we're having problems now in the global south. And they're saying that, and Dr. Richards is proposing that the reason why that we have so many problems in the underdeveloped global south is because of colonialism. And he's saying that the global public health system is broken. And it's broken because of the same imbalance of power that existed during colonial time still exists today. That's the root of the problem, is the uh, a imbalance of power, meaning to say that the colonial countries still exert either uh, some type of pressure, either through policy, in some cases actually physical and governmental practices. So Dr. Richardson, in this article that was in NPR, it's a good article, and it's also they give you NPR actually lets you listen to the interview, and the interview is quite revealing. And also that in the article it lists a book that Dr. Richardson that he is uh, got, that he's used as a textbook. So I'm going to order that and delve into that textbook. That textbook is titled Epidemic Illusions on the Colonialism of the Global Public South. Epidemic illusion. That is saying is that we think that there is a epidemic when there is not an epidemic going on. It's just an illusion. Also, and he relates back to the coloniality and the broken global public health system that we have here in the United States. We're part of the global health system, and that is versus a health system, individual health system. Global one is the people who tracking diseases and that move around the globe. So that's one of the things that we want to talk about. So over the next few days after I get the book and analyze it a little bit, we will bring up some of the topics, because I think this will be interesting for a number of people, because I'm sure a lot of people always look and think about, why are so many people dying in Africa, South America, and even Central America to a certain extent. So this book should highlight some of those things and maybe give us some solutions to it, even though he lists in the interview 2 solutions. He says that there should be reparations and also economic investment by the colonial powers, but into those reparations and the economic investment should go into the public health system. And which he still relates in the article, which is kind of interesting, is that you look at all the global aid that's going to Africa and different places. In a sense, that's, I consider, a part of reparation of this economic investment. However, they reported something like $160 billion went in there, but $200 billion in aid, well, not aid, but materials, goods. And he cites the case of both Congo and Sierra Leone that are rich in diamonds and minerals, that there is more diamonds and gold and everything coming out of Congo than what is actually going in. So there's a net negative thing that's going into the Congo. So there's about a $40 billion difference overall throughout the global south and the northern hemisphere. So we're going to talk about that a little bit more, but thank you for stopping by today, and we will get into that a little bit next week. But in the meantime, let's get the pandemic under control by washing our hands, socially distancing ourselves, and also wearing our mask. And we will talk with you later. Take care. Goodbye.